Ladies and gentlemen, what you can see here is how many smokers feel. Smoking is a prison of dependency from which many just cannot escape. The fact is that most smokers really want to quit, but the vast majority fail simply because they are unable to break their smoking addiction. This is Will. If you were in Will's position right now, many of you may think that escape is impossible, but let's just wait and see. In the mind of a smoker, cigarettes are the chains and nicotine the lock that keeps them trapped with little hope of release. Without medical help, I'm afraid they are right. 97% of smokers who try to stop by themselves will be smoking again within 1 year, and most of them in the first 8 days. What they do not realise is that GPs like you and me may hold the key. We really may be their best chance of escape from smoking, and of course, the inevitable damage which it causes. I'd like to show you how we can help our smoking patients set themselves free. The problem is that most smokers know that they should stop. What they do not know is how best to do it, which is with a combination of support and treatment. As a result, they keep trying by themselves again and again, and failing. We now know that smoking is a chronic, relapsing medical condition, not a lifestyle choice. It needs to be treated medically. And the first step to the medical treatment of smoking is a 30-second brief intervention by you or me. It is this brief intervention which has been shown by a Cochrane review to be effective. Giving brief advice on stopping smoking to 40 smokers may lead to one long-term quitter. Now, at 30 seconds each, that's just 20 minutes work, which isn't bad. There are 3 easy steps to this 30-second brief intervention. First, establish the smoking status. You might say, do you smoke? Or if you knew they did last time, are you still smoking? It may come as a surprise, but many smokers expect and actually want us to ask about their smoking. Don't forget, most smokers want to quit and want our help. Second, give brief advice on how to quit, that the best way to stop is with a combination of support and evidence-based treatment. It is important to use positive, sympathetic and encouraging language here. For example, did you know that the best way to stop is with a combination of support and treatment, which makes it many times more likely you'll succeed? Third, tell them how and where they can get help to stop. Present the options available, but leave them in control to choose the best method for them when they are ready to quit. You might say, come back and see me and I'll go through the treatments and support we can give you. Or you might send them to see someone else from your practice or locally. These 3 simple steps can be used proactively in almost any consultation with a smoker, and as they are positive, evidence-based and informative, will be much better received by your smokers than the usual nag to stop smoking. Before I finish, I'd like to leave you with one final thought. In the time it's taken me to talk to you about the importance and success of brief interventions, Will, our escapologist here, has succeeded in breaking free from his chains. Equally, taking just the 30 seconds to talk to your smoking patients could unlock them from their chains and lead to a successful quit and, of course, improved health. It sounds so simple, yet those few seconds can potentially be life-saving. Your brief interventions can make a real difference.